Are you 50 years old and dealing with pain in your knee? If so, there's a very good chance that it's caused by osteoarthritis. In this video, I'm going to teach you how to stretch, massage, strengthen, tape, and balance your way to healthier knees. Hi, I'm Dr. Daniel Bridge. I'm a chiropractor here in Helena, Montana, and this channel is dedicated to teaching you how to take care of your spine as well as your extremities. Knee pain is so prevalent, and this is something that we see a lot of in our office. Stay tuned to learn how to solve your problem. While you can get arthritis in any joint in the body, it's extremely common in the knees. And the reason for that is so much of our weight goes right through our knees with every step that we take. And as you know, we take many steps throughout the day, so each time we do, it's weight through the knees. It's very common in people that do a lot of squatting, a lot of kneeling, a lot of stair work, people that have excessive weight gain, and also people with very flat feet. Those populations are going to see more arthritis in the knees, and they're going to have a bigger need to take care of this. I've heard a lot of people say, oh, I've got arthritis in my knees, there's really nothing I can do about it, but that's not true. I'm going to show you things that you can do at home that don't take a lot of time and that don't really need any special equipment that can help you get instant relief from your knees. The first technique that I'm going to show you is called instrument-assisted soft tissue mobilization. I'm going to show you how we do it in the office, and then I'll teach you how you can do it at home. So the technique that I use is called Factor. They sell these stainless steel instruments to doctors. They have different curves that I can use on different body parts, for example. But it's also known as gua sha. People call it Graston. Everybody has their own little spin on it. Essentially, when we're working around the knee, I will get my emollient, which is a coconut oil beeswax mixture, and I will scrape some off. And just kind of like I'm buttering a piece of bread, I will spread it around the knee. So be careful, because this technique might leave you hungry. But once it's spread around, I start just doing some nice little scraping motions. And you want to be at about a 30 to a 45 degree angle against the area that you're working on. And you're going to work on those quad muscles on both sides, and then you're going to just really work all around the kneecap. You have the patellar tendon here. You're going to really want to work on that. And then all the little nooks and crevices around the knee. You don't want to be really going over bone too hard, because that's really not what we're trying to do. You don't want to go over any open wounds or any areas that are too sensitive. Just steer clear of that. Your skin will start to get red. That's very normal. Obviously, you don't want to be bleeding, but keep scraping, and that's going to help to relax those muscles, break down scar tissue and adhesions, target trigger points, and it can be very effective in instantly getting pain relief, decreasing some of that stiffness that you might be dealing with in the knee. I also like to move the knee until I get to a point where it's hurting. If your knee's not hurting when it's straight, I wouldn't scrape while it's straight. Maybe to start off you could, but then I would want to say, okay, ooh, it hurts when I bend my knee to here. This is where it hurts, so this is where and how I'm going to scrape. Now at home, you might not have a tool specifically for this. Grab a butter knife, grab a spoon. People use coins, and you can grab like some coconut oil and put it on your butter knife and use the back of the knife or even the handle and just do what I showed you and just scrape. And at first it's going to be tender, but if you do this every day, those muscles are going to soften, they're going to become more supple, and it's going to help with the healing process and with pain relief. As I said prior, flat feet can really contribute to knee pain as well as arthritis buildup in the knees. So one thing that I do with my patients is I custom fit them for orthotics. So this is a casting kit that has a soft foam in it that will retain its shape once it's squished down. So I have my patients step their foot in each one of these, and it gives me a really good mold of what the bottom of their foot looks like. And then I ship it off to the company that custom fits my patients with an orthotic that they can put in their everyday shoe that's going to support the arch, as well as different parts of the foot to help with the foot. Now, depending on where you're at, you may not have access to orthotics like that. Most drugstores are going to sell different types of orthotics, and you'll just have to try them out to see what's going to work for you. You want something with a good arch in it, not too tall, especially with flat feet starting out. It might be too much for you. You'll just have to see. But that's one thing that you can do on your own that's really going to help to stabilize the feet and support all the way up to the knees. Having muscles that are too weak will contribute to knee pain, as well as having muscles that are too tight. Let's get those muscles stretched out. The first one that we're going to stretch is your calf muscle, your gastrocnemius or your gastroc. Go against a door frame or against a wall, and arms against the wall, or even forearms. And right now I'm stretching my left calf muscle, so I'm going to take my right knee and I'm going to bend it while keeping my left knee locked and straight. And I bend until I feel a good stretch there in the calf. I'm going to hold it for 15 to 30 seconds. You don't need to bounce. Try not to overdo it, and hold it as you feel that good stretch. And then you switch sides. This side's tighter for me, so I don't have to bend my knee as far before I feel that good stretch. After you've done both sides, you want to stretch the lower muscles in the calf. And the way you do that, it's similar to the first, but instead of having a straight leg, you actually bend that back leg and you lean forward until you can feel a good stretch. For me, I'm feeling it down lower. You want to stretch both areas out on both legs. Now let's move up to the hip. The TFL, or the tensor fascia lata, is one of these hip muscles that stays really tight, and it can affect the way that the knee is tracking and how the hip's moving. Put your forearm against the door. In this example, I'm going to be stretching out my right hip, so all my weight goes on my right leg. I cross my left leg over my right leg, and I bend this hip towards the wall. This is the exercise or the stretch that I call the magnetic hip. Pretend this is a magnet, and this is a magnet, and it's sucking that hip towards the wall, and then you hold it for 20 to 30 seconds. Repeat on both sides. After we stretch, we have to strengthen the hips and the knees. So the first exercise is called a hip hinge chair squat. You'll need a nice chair, firm, sturdy, and you're going to stand in front of it with your legs shoulder width apart. You're going to bend your knees, but not over your toes. Keeping your low back straight, you're going to slowly lower until you sit on the chair. And then you're going to return to standing. And you're going to slowly lower and return to standing. You're going to want to do 3 sets of 10 of that exercise. Oh, didn't see you there. I was just doing a little modeling. But while I'm here, I might as well show you the next exercise. It's called a quad set. Take a towel, roll it up into a rolled up towel, place it under the affected knee, and you're going to lay down, and you're going to straighten out your leg, pushing your knee in against the towel. And you like to, as you contract that muscle, it's going to slide that kneecap up, and you're going to hold it for 5 seconds, and then relax. And hold it for 5 seconds, and relax. You'll want to repeat that 10 times, and you'll want to do 3 sets. One of the problems with osteoarthritis in the knees is it becomes really hard to straighten out your knee, and then you start limping, and it can throw off your whole gait. One way to prevent that, or to regain that straightening of the knee, is a quad set, while at the same time you're gently strengthening the quads. I'm not going to lie, I'm a little nervous about this next part. I'm not prepared, and I did not shave my legs for this, but the show must go on. Kinesiology tape can do a really good job of supporting the knee. So I'm going to show you how to tape the knee to provide some support, and then you're going to get to watch me rip it off and all the hairs along with it. So I better do this in the first take. You get your strips of tape. I like to cut them about 12 inches long, match up the corners, and then round those corners. That's going to help the tape from peeling off too quickly. Do that on both pieces of tape. There's a few different ways that people will tape their knees. I'm going to show you the one that I like. It's pretty simple. It's hard to screw up. You rip off about 1 inch from one corner and peel off the tape. And then on the inside of your knee, maybe 4 or 5 inches up, place that tape. Really stick it in good, because when you rip it off, you want all the hairs to come off. And you peel down the inside of that kneecap and follow that kneecap as it curves out. And bring it out to the side. Really rub it on there. And really, you do. You rub it. Some pressure, some friction, and some heat can help that tape to bond with your skin. And in this case, with my hair, do the same thing on the other piece of tape. and you just do the opposite. You start on the outside of the knee, and you come down along the outside of the kneecap, follow that, create an X down here. With good tape, this will stay on for 3 or 4 or 5 days. You can shower in it. I would wait 20 minutes, and I put the tape on while the knee is bent. And it's going to stay on. You'll notice, you'll walk around and instantly you'll feel a little lift in the kneecap. It feels a little looser, it feels better. And that's all, right? A promise is a promise. So let's, ouch, even just peeling this, okay. That wasn't as bad as it could have been. It can be worse. The longer you leave it on, the more hair you're going to peel off. Try the tape, let me know what you think. Weakness in the ankles can really cause a lot of issues in the knees. If your ankles aren't there to stabilize everything, it goes directly up the chain, and the next joint to take that instability is the knees. It will cause pain. It will lead to more problems. There's a lot that you can do at home to improve your balance and the stability of your ankles. What you'll need is a towel. Any size will do. I'm just taking this hand towel, wadding it into a ball, and I place it on the ground, and then you stand on it. This is not a stable surface. And you just stand on it, and automatically your body's going to try to fall over, and you just need to do your best to stay on there. If you need something like this to kind of support yourself, it's a good way to start out. Lift your hand a little bit, and you'll feel those stabilizing muscles in and around your ankle going crazy. And then you switch sides. It's harder than it looks. If it's easy for you, if you've got really good balance, get on here and then take it up a next level and close your eyes, and it becomes even that much harder. There's lots of different things you can do to step this up. If you're just standing there, have a friend toss you a ball, and you're trying to catch this ball while stabilizing and balancing on this towel at all times. Now, I will say, if the towel is too much for you, start out just on the ground, take your shoes off, leave your socks on or go barefoot, and just stand on one foot, and even that's going to be challenging. In this video, we've showed you how to stretch, massage, strengthen, tape, and balance your way to healthier knees. It can provide instant relief, and for long-term results, really stick with this and do it very consistently on a daily basis, and you're going to build stronger knees. If this doesn't solve your problem, see a chiropractor like myself who specializes in knees. There's lots of different things that I do in addition to what I've shown you today in a clinical setting that can really help the hardest of conditions. Thanks for watching. Subscribe to the channel, like this video, and check out some of my other videos here in order to learn to take care of your health even better.